Myth: pets at home spread COVID-19. At present, there is no evidence that companion animals or pets such as cats or dogs can be infected with the new coronavirus. However, it is always a good idea to wash your hands with soap and water after contact with pets. Myth: vaccines against pneumonia protect you against the new coronavirus. No. Vaccines against pneumonia do not provide protection against the new coronavirus. The virus is so new and different that it needs its own vaccine. Myth: rinsing your nose with saline will help prevent infection with the new coronavirus. No, there is no evidence to prove that rinsing your nose with saline can protect you from the new coronavirus. Myth: eating garlic can help prevent infection with the new coronavirus. Garlic is a healthy food that may have some antimicrobial properties. However, there is no evidence from the current outbreak that eating garlic has protected people from the new coronavirus.
COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose, or mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19.
President grants assent to the ordinance that aims to protect healthcare personnel and property against violence during epidemics. The cabinet had approved the law outlining hefty fines and jail terms to perpetrators of such attacks. Prime Minister says the ordinance reflects commitment to protect COVID warriors. Home Ministry directs states to ensure adequate security to healthcare professionals against violence, asks states to take strict action against those obstructing performance of last rites of frontline healthcare workers succumbing to COVID-19. Total number of positive cases in the country numbered at 21,393. 4,257 people have recovered, while the death toll stands at 681. A total of 5,542 samples from 4,85,172 individuals have been tested as on this morning. 21,797 samples have been confirmed positive. Prime Minister Narendra Modi underlines the strength of Indo-Nepal ties after Nepalese PM expresses gratitude for generous support of essential medicines to fight COVID-19. PM Modi holds telephonic conversation with Irish Prime Minister Leo Varadkar to discuss the pandemic situation. WHO says most countries are still in early stages of the epidemic, even as global COVID-19 cases crossed 26 lakhs with more than 1.83 lakh people dead due to the virus. President Trump signs an order partially suspending immigration to the USA amidst the situation. Hello and welcome. You're watching DD News and DD India with me, Manu Bhattacharya. In view of the crisis arising out of the COVID-19, Union Ministry of Finance has decided that the additional installment of dearness allowance payable to central government employees and dearness relief to central government pensioners due from the 1st of January 2020 shall not be paid. The additional installments of DA and dearness relief due from July 2020 and the 1st of January 2021 shall also not be paid. However, DA and DR at current rates will continue to be paid. The number of active cases of COVID-19 in the country has now reached 16,454. The number of those who've recovered and have been discharged has now gone up to 4,257. There have been 681 deaths and 1 migration, bringing the total number to 21,393. Well, President Ramnath Kovind on Wednesday gave his assent for promulgation of an ordinance making acts of violence against healthcare personnel fighting the COVID-19 pandemic as cognizable and non-bailable offences. The ordinance was necessary in the wake of several incidents of assault and intimidation being faced by healthcare professionals. Here are the details.
Amidst corona crisis in the country, Union Cabinet took several important decisions. The major decision taken by the Cabinet was to bring an ordinance to amend the Epidemic Diseases Act 1897, making attacks on doctors, paramedic staff and ASHA workers a non-bailable and cognizable offence, punishable up to 7 years in prison and fine up to ₹5 lakh. The police will investigate the case in 1 month and the case will be fast-tracked with the final judgment to come within a year. The amended law will come into effect after the President promulgates it and the government notifies it. Prime Minister Narendra Modi too took to Twitter and said that the tough law will ensure safety of healthcare professionals at this critical time. He said, "The Epidemic Diseases Amendment Ordinance 2020 manifests our commitment to protect each and every healthcare worker who is bravely battling COVID-19 on the front line. It will ensure safety of our professionals. There can be no compromise on their safety."
Today, Cabinet approved promulgation of an ordinance to amend the Epidemic Diseases Act 1897 in the light of pandemic situation of COVID-19. And this actually protects the whole health fraternity. The ordinance proposes that within 30 days, the investigation will be over. Within 1 year, the decision of the case will be, the final decision will come, and the punishment ranges from 3 months to 5 years.
The Union Cabinet approved significant investments to the tune of ₹15,000 crore for India COVID-19 emergency response and health system preparedness package. The Cabinet has also made a provision of insurance of ₹50 lakh of people fighting the coronavirus pandemic. With this, now treatment of non-corona patients under Ayushman Bharat scheme will also be possible in private hospitals.
COVID hospital, which was 0, is now 700 plus. Isolation bed nearly 2 lakh. Ventilators nearly 15,000. PPEs and N95 mask, which was not produced in our country for 70 years, now are produced in our country, make in India.
Prior to the cabinet meeting, Union Home Minister Amit Shah and Health Minister Dr. Harshvardhan interacted with doctors and representatives of the Indian Medical Association through a video conference in New Delhi on Wednesday morning. Keeping in mind all the concerns of the doctors about their safety in the fight against the coronavirus, the Home Minister assured them that the central government would leave no stone unturned to ensure their well-being and safety. Union Home Minister Amit Shah strongly condemned the recent attacks on health workers and said that the Prime Minister Narendra Modi is closely taking note of all the issues and concerns of doctors. He said that all necessary arrangements will be made to prevent such incidents in future. Meanwhile, the victim of the attack in Muradabad has expressed happiness over the steps taken by the central government to protect the doctors.
सरकार ने शायद काफी लंबे समय से लोग ऐसा सोच भी रहे थे, मांग रहे थे, तो सरकार ने जो इस प्रकार का प्रावधान किया है या सरकार बहुत जल्दी इस प्रावधान को ला रही है, तो एक अच्छा प्रावधान है। शायद तो जो लोग इस प्रकार के घृणित कार्य करते हैं वो भी सोचेंगे।
बहुत वेलकमिंग स्टेप है। इस टाइम की जो सिनेरियो चल रहा है, जो अटैक्स हो रहे हैं, डॉक्टर को वैंडलाइज किया जा रहा है, ये वाली सारी चीज़ें डॉक्टरों की सेफ्टी, बस डॉक्टरों की नहीं, नर्सिंग्स की, जो हेल्थ केयर प्रोफेशनल्स है उनकी, जो लैब टेक्नीशियंस है उनकी, जो काम हेल्थ सेक्टर में काम कर रहे हैं, इन सब का मॉरल बूस्ट करेगा।
Later, on the instructions of the Home Minister, an advisory has been issued to the states by the Ministry of Home Affairs. The Union Home Ministry has asked the state governments to ensure the safety of the corona warriors. The Union Home Secretary has written a letter to the principal secretaries of all states and said that the safety of all frontline warriors, including doctors, should be ensured. Referring to the guidelines of the Supreme Court, states have been told that it is their responsibility to provide full protection to the doctors and other personnel fighting the coronavirus crisis. The centre has also asked states to appoint nodal level officers at the district level so that they can be available 24 hours to address aspects related to the security of corona warriors. The Union Cabinet approved extension of relaxation of mandatory requirement of Aadhaar seeding of data in respect of beneficiaries of the states of Assam and Meghalaya and Union territories of Jammu and Kashmir and Ladakh for 1 year with effect from 1st April 2020 under the Pradhan Mantri Kisan Samman Nidhi scheme. The Cabinet approved fixation of nutrient-based subsidy rates for phosphatic and potassic fertilizers of the year 2020-21. The expected expenditure for release of subsidy on PNK fertilizers during 2020-21 will be 22,186.55 crore rupees and to be provided on the subsidy rates approved by CCEA to fertilizer companies. With Shalendra Mishra in Delhi, Newsnight Desk, DD India.
Prime Minister Narendra Modi, through a tweet, responded to Nepalese Prime Minister KP Sharma Oli. Oli, in his tweet, had thanked India for its gifting 23 tons of essential medicines to Nepal, and PM Modi in his tweet said, India-Nepal relationship is special. Our bonds are not only strong but also deep-rooted. India stands in solidarity with people and the government of Nepal to fight COVID-19 pandemic. PM Modi held a telephonic conversation with Irish Prime Minister Leo Varadkar to discuss the pandemic situation. He tweeted, and I quote, discussed COVID-19 pandemic with Ireland's PM. Mr. Leo Varadkar, India and Ireland share similar approaches on many global issues. We will work together to further strengthen our partnership in health, science and technology to jointly address challenges of the post-COVID world. ICMR has forwarded a protocol for using rapid antibody tests to all states. It has reiterated that antibody rapid tests are largely to be used as a tool for surveillance. Globally also, utility of this test is evolving and it is currently being used for detecting the formation of antibodies in individuals. These test results are also dependent on field conditions. As noted by ICMR, these tests cannot replace the RT-PCR test to diagnose COVID-19 cases. ICMR has assured assistance to collect data from various states to assess the scope and extent of utility of these rapid antibody tests in field conditions. And ICMR shall keep advising states on a regular basis. States have also been advised to follow the prescribed protocol for these tests and use them for purposes for which they are meant. As the country faces corona pandemic, Prime Minister Narendra Modi will interact with chief ministers of states on 27th April, that is a Monday, via video conferencing. And after the lockdown came into force, this is PM's third interaction with chief ministers. First, the lockdown was enforced till the 14th of April, which was later extended till the 3rd of May. The previous video conference of PM with chief ministers took place on 11th April, when nearly 13 chief ministers called for extension of the lockdown. During this 4-hour-long interaction, PM had taken feedback from chief ministers on whether to end the lockdown or to extend it. The meeting saw all chief ministers in favor of extending the lockdown. And Prime Minister Narendra Modi will address the various Gram Panchayats across the country on the 24th of April, which is a Friday, on the occasion of National Panchayati Raj Day. PM Modi will interact with various participants through video conferencing in view of the lockdown. PM Modi will also launch the Unified E-Gram Swaraj portal and mobile app on the occasion. The Unified portal is a new initiative of the Ministry of Panchayati Raj, which will provide Gram Panchayats with a single interface to prepare and implement their Gram Panchayat development plan. Prime Minister will also be launching the Swamitva scheme. To quash rumours pertaining to COVID-19 in society, Ministry of Health and Family Welfare has released a video appealing people not to stigmatize the patients of novel coronavirus and to abstain from spreading fake information. Ministry of Health and Family Welfare has also expressed gratitude to healthcare workers who are on the front line in the fight against the pandemic COVID-19. The ministry has also urged people to support, praise and appreciate the healthcare workers. Union Minister Prasar Bharati has clarified that the government has not issued any directive that if any coronavirus case is detected in a factory, there will be FIR against the factory. In a tweet, the minister said that this is a rumor and absolutely false. He added that industry can go for production fearlessly in the allowed areas by taking adequate precautions like social distancing, wearing face masks, etc. In other news, Information and Broadcasting Minister Prasar Bharati has said that the government condemns attacks on any journalist. Terming any such incident as undemocratic, the minister said that as per the present law, police will definitely take action if there is a complaint.
किसी भी पत्रकार पर हमला बहुत दुर्भाग्यपूर्ण है, निंदनीय है। ये लोकतंत्र का परिचायक नहीं है और लोग जो टॉलरेंस का उपदेश करते हैं वो इतनी इंटॉलरेंस कैसे बनते हैं, ये देखने लायक बात है। और इसलिए पत्रकारों पर हमले बिल्कुल नागवार है और इसके लिए अभी भी पुलिस कार्रवाई करती है और करेगी, ये मुझे पूरा विश्वास है।
US President Donald Trump signed an order to temporarily block some foreigners from permanent residence in the United States, saying he was doing so in order to protect American workers during the coronavirus pandemic. The order is to last for 60 days and then will be reviewed and possibly extended. At the Daily News briefing, Trump said that the move will ensure that unemployed Americans of all backgrounds will be the first in line for jobs as our economy reopens. He also said it will preserve our healthcare resources for American patients afflicted by coronavirus. Meanwhile, the U.S. House of Representatives is likely to pass a nearly $500 billion coronavirus relief bill today, and the bill, which will provide funds to small businesses and hospitals struggling with the economic toll of a pandemic that has killed over 46,000 Americans, is expected to be the fourth coronavirus measure passed by Congress, boosting the overall federal financial response to almost $3 trillion. Over 8.39 lakh people are coronavirus infected in the U.S., while 77,366 persons have recovered. 2 cats have become the first pet animals in the United States to test positive for COVID-19. The cats were from different areas of New York State, and both were taken to vets suffering from mild respiratory illnesses. The first cat came from a household in which none of the residents had any symptoms. The second cat's owner was later diagnosed with COVID-19. Both cats are expected to make a full recovery. With Europe's second highest death toll and the world's second most infection cases, the Spanish government has allowed children below 14 years of age to take short walks outside under the supervision from this weekend. Relieved Spanish parents welcomed the concession as the Spanish government voted to extend Spain's lockdown until the 9th of May. Under the rules, children will be allowed outside between 8 a.m. and 10 p.m. for up to 1 hour a day and must be accompanied by an adult with whom they live. Children will also not be allowed to use play parks and must respect social distancing rules. Spain's death toll due to coronavirus has reached 21,717, while the number of confirmed infections have risen to 208,389. Spain is the worst hit nation after US, with rising cases every day. However, the country aims to begin winding down its coronavirus lockdown in phased manners towards the end of May. With the epidemic seemingly past its peak, Spain's Tomatina festival, which is considered as one of the world's largest food fight festivities, was also suspended amid the coronavirus crisis. In 75 years, the festival has only been suspended once before, when the mayor cancelled it in 1957. In Italy, the total count of confirmed cases of COVID-19 has reached 1,87,327, while the death toll is at 25,085. The country ranks second highest in terms of casualties across the world after the US and Spain. Meanwhile, Italian sports minister Vincenzo Spadafora said that the government is still not ready to set a date for Serie A teams to start training again ahead of a possible resumption of the league. Professional football has been suspended in the country since the 9th of March over the COVID-19 pandemic. France has registered a total of 21,373 deaths from coronavirus infections, the fourth highest casualty tally in the world, but trailing just a few hundred behind Spain, which has a death toll of 21,717. In good news, the number of patients in hospitals and intensive care continued to decline. The number of deaths has also been largely stable in the past 3 days. The country has been in lockdown since 17th March in a bid to slow the outbreak. The government aims to ease from 11th May, considering the downfall in cases. In total, there are 1,57,125 confirmed or possible cases of coronavirus infection, while 41,326 persons have recovered. Brazil's Health Minister Nelson Teach told to the media that the country could not survive under a long-term lockdown, adding that the ministry will work with Brazil's regions to open up the country amid the spread of the coronavirus. Teach's comments came after Sao Paulo state announced that it will gradually reopen its economy in a safe way starting from 11th May by relaxing some social distancing measures put in place to stop the spread of the new coronavirus. Given the size and diversity of Brazil, he said that it was up to states to do what is right for their region. However, Brazil has reported a total of 45,757 confirmed cases of COVID-19 with 2,906 deaths so far. And let us all say no to stigma and discrimination and instead salute the corona warriors fighting for the health of all of us in the country.
हम आज फिर ये युद्ध लड़ने आए हैं। हम आज फिर अपना फर्ज निभाने आए हैं। हमारे भी घर वाले चिंता करते हैं। पर आज देश की कोरोना से लड़ाई है और हमारा हौसला ही तो इस जंग का सिपाही है। कोई कुछ भी कह ले या कर ले कुछ भी, हम खुद से पहले अपना देश बचाने आए हैं। इस रणभूमि में शायद सांस हमारी भी टूटेगी, पर तुम्हारे प्राण बचाने को हम खुद को निछावर करने आए हैं। वार सभी हम सह लेंगे, पर हार नहीं हम मानेंगे। इस अंधियारे से हम जीतेंगे, फिर देश को रोशन कर देंगे। हम आज फिर ये युद्ध लड़ने आए हैं, हम आज फिर अपना फर्ज निभाने आए हैं। आइए करें उन्हें नमन जिनके लिए सबसे पहले है वतन।
And with that, we come to the close of this edition of Midday News. But up next is Doctors Speak, where you can call us and ask your questions. An eminent panel of medical experts will be here in the studio, as well as will be joining us virtually to answer all your questions. So do call in. Thanks for now.